Hi everyone, Dr. Nemechek here, and I want to help you to determine if you have autonomic dysfunction. By the time you've been searching around the internet and you found my videos, you've got some things that are suggesting this, and so I'm going to teach you how to go through and figure this out. It's actually much easier than you think, and you'll be frustrated why the doctors didn't put all this together, okay? Just quick review, your autonomics have two branches, sympathetic, parasympathetic. The sympathetics flow down through the spine. The parasympathetics generally, most of it flows down through your vagus nerve, and they regulate everything. Hormones, metabolism, immune system, emotions. This graphic shows how they regulate your organs. They also control your blood pressure and your heart rate. Now, one of the problems with, in my opinion, modern medicine is everybody thinks you have to have a blood test or an x-ray or some kind of test to make a diagnosis. All right? Actually, most of medicine, and that's called the laboratory diagnosis, most medicine really goes off of clinical diagnoses. But it's just doctors don't understand what that picture looks like in autonomic dysfunction. Now, here's the difference between clinical and laboratory. So you just think of clinical as like, how's the patient feel? What are their symptoms? Kind of what's the story that they're experiencing? What problems do they have? What problems do they not have? All right? You can get really, really accurate if you understand the story of what any particular illness looks like. And as an internal medicine doctor, that's what I'm trained to do. And the modern level is people that go through these tests. You've got blood tests, you've got EKGs, you've got echocardiograms. They may do a tilt table or gastric emptying study, and they I don't know, everything's normal. And they look at you and you start thinking, do they think I'm making this up or something? Okay. Because they aren't really sitting there talking to you. They need the story. That takes a lot of time. And actually, medicine's failing completely right now because they just want to run the tests because that's where the money is, and they don't want to spend the time. Literally, my first adult visits here are an hour and a half to 2 hours of just talking and figuring things out and teaching the patient and so forth. Okay? I know what people have before I've even looked at their lab tests or anything, just from the story. So that's the problem right now. So, what's your story? What are your symptoms? Well, I've put on my website, here, do my symptoms suggest autonomic dysfunction? So we have a thing just called the ANS quiz, Autonomic Nervous System Quiz. It's a series of questions that are yes or no. Do I snack frequently? Trouble concentration? Do I feel unusually tired? And you just go through these. Doesn't even take 5 minutes, okay? And it'll give you an answer at the end of how likely or not that your symptoms suggest autonomic dysfunction. And so if you go to our website, Nemechek Autonomic Medicine, and then the discussion section below, there's a link for it. You would just go here under ANS Quiz. Of course, I've got a slow connection here. Anyhow, you click on this, and it will pull up those pages I was talking about, and you go through and do that. Now, so you go through that, you're like, wow, this thing's telling me I might have autonomic dysfunction. Well, what do you do? Well, most of you have already talked to doctors about your symptoms, and they've excluded other things that can mimic your symptoms. They've done your blood work, your kidney, liver, thyroid, your blood counts, your CBC, they're all fine. They can't find anything there. Maybe a doc did an MRI or a CT scan of your head or your neck because of some neck tightness that you've had, nothing there. And then sometimes you've been sent to the neurologist or the cardiologist, and they ran a bunch of tests, nothing. Those tests, when they are normal, mean a lot. It means you don't have something else. It means like you don't have a brain tumor, you don't have anemia, your thyroid, you don't have hyperthyroidism, or other things that can account for your symptoms, okay? And as you eliminate these things, that means you're closer to having autonomic dysfunction as the cause. Okay? Now, one of the major things that happens when you have autonomic dysfunction is that people have trouble regulating blood pressure to their brain, and it causes a bunch of their symptoms. And so you can determine this at home. And you can check your blood pressure at home. It's not just check your blood pressure, you do it in a very particular way. It's called the Shilong test. Now they call it the 10-minute orthostatic vital sign test. Basically, you want a cuff blood pressure thing, not something on the wrist, not a finger device. It's got to be an arm cuff. You measure, you lay down for 5 or 10 minutes. You measure your blood pressure and your pulse. And then you stand up for 5 or 10 minutes. 10 minutes is best if you can. If you're starting to get a little woozy at 5 minutes, just take the reading at that point. Okay? So now we have supine or laying, standing measurements. Now, normal. If you're normal, your autonomic system is going to adjust your blood pressure and pulse to fight against gravity to get blood pressure to your head. So as you stand up, your blood pressure is going to be stable or just decrease a tiny bit. Okay, it's not going to go down more than 20 points on the systolic or 10 on the diastolic, and your heart rate might go up a few points, 5, 10, 15. That's it. Those are normal changes for your fight against gravity. If your autonomics are not working, probably the most common thing that happens is when you stand up, your systolic blood pressure drops by 20 points, and your diastolic by 10, and your pulse will go up more than 20. Your body's struggling to get blood pressure to your head. Okay, and again, if you can go 10 minutes, it's the best, most accurate test here. Now, if you have a thing called POTS, we call that orthostatic hypotension. Okay, many people with autonomic dysfunction have that problem. If you have POTS, or postural orthostatic tachycardia syndrome, and this is becoming very common after COVID infection, your blood pressure is about the same. It doesn't drop at all, but your pulse takes off, like goes crazy. Okay, 30, 40 beats more from where you were when you were laying flat. People often feel like their heart's beating out of their chest. Completely abnormal. Now, again, if your lab work's all okay, you saw a cardiologist, you've seen these doctors at the ER that run EKGs, they can't find out what's going on with you, all those tests are normal, you got POTS. That's all you need. You don't need anything else. You don't need some fancy thing. Okay? Now, people with severe or advanced autonomic dysfunction, when they stand up, their blood pressure will just plummet more than 30 points, and their pulse won't go up. They just can't raise. Their sympathetics are so badly damaged, they can't generate a response on their pulse. Now, that's pretty uncommon. Most people, you're going to have this orthostatic hypotension or this POTS. Okay? Now, just quick review. Normal, again, this is the difference between your blood pressure laying down and standing. When you stand up, maybe a slight little drop in blood pressure, slight increase in pulse. Okay? But with orthostatic hypotension, your blood pressure is dropping significantly and your pulse is going up, good 20 points or more. Okay? Now, the difference here between orthostatic hypotension and POTS, now these are both autonomic dysfunction. It's just different names for the picture or the patterns that you see here. Okay? POTS, blood pressure doesn't change much. Pulse is a prominent thing, just skyrockets. And again, for very advanced patients, when they stand up, if they have a big drop in blood pressure with no heart rate increase, that's pretty severe. Now, you've gone through, you're like, okay, now I understand all these visits where they couldn't figure out what I had actually means they figured out what you don't have, and that leads you down the road to autonomic dysfunction. Here, I've got some. Now, I can measure this stuff at home with a simple blood pressure cuff I bought for $30, $40. And then what do? Well, that's what Nemechek protocol was designed for. First designed in adults, We started treating people about 20 years ago. It's been refined. We're really at Nemechek Protocol 6.0 at this point. You get the blue book, even though it's kind of talks about stuff for kids like ADD and PANS and PANDAS, stuff like that. The dosing here for adults is exactly what I would treat every single adult I'd have in my practice. So it goes through a lot of the mechanics, it goes through the science behind it, and most people with autonomic dysfunction, they start feeling better, substantially improved within the first few months. Many are normal or near normal 6-8 months out, okay? But often within a month or two, people are like, oh yeah, it's getting better. This is not so bad, that's not so bad, this is not so bad. So that's to help you. If you want, some people will fly out to Arizona for their first visit. I kind of set them all up. We go through the whole thing. I teach you a lot of stuff. And then they'll fly home, and I can follow up and guide you through Zoom visits for 1.5 years. Usually by a year, most people are fixed. They don't even need me anymore. So that's another option for a lot of people. That's all for today. Hope that helps everybody. Have a great day.